Max Wardell, overheadathletics.com. Today I got a nice case study here. We got Parker on the table. We're going to go through some stretching, massage techniques that we're going to use with him, as well as some throwing stuff. He's got some games coming up here. We want to make sure he's ready to go. He's had a little bit of a lateral epicondylitis, a little bit of a strain in the extensor muscles there, so we're going to work on that a little bit. We've already had him warm up. We've had him stretch his hamstrings. Let's get into the video. So we've got our masks on today. We're still on partial mitigation here. I'm just looking at how he moves a little bit to start. He does have a little bit of limitation here in pronation, so we're going to stretch that a little bit. But I'm just starting to get it moving a little bit through pronation and extension, similar to what happens during the throwing motion, just not in the same position of the shoulder. Just kind of letting it move a little bit. And then I'm going to start to apply some massage pressure here with the thumb. What I'm kind of doing is I'm pulling on that brachioradialis, and I'm kind of pulling that brachioradialis away from the underlying tissues here. And then I'm going to go into the extensor portion, and I'm going to kind of use a more diffuse contact, just doing lengthening through elbow extension, and that's a little bit more tender for him. And right now what I'm trying to do is I'm just trying to relax your elbow. I'm just trying to loosen that up a little bit, as he starts to warm up. Here I'm kind of rotating that radius bone into supination, and while I do that I provide a medial pressure. So it's almost like I'm shearing those tendons and those muscles on the underlying fascial tissues and the underlying muscle. Just trying to get things loose. He's had an ultrasound today, or yesterday? Yesterday, by his orthopedic physician. And what they found was just there was some inflammation in the area, evidence of muscular strain. And so basically we're just trying to promote some blood flow, get things moving, and desensitize the tissue. So I don't need to spend all day doing this, but I can spend about 3-4 minutes just trying to get these soft tissues moving, massaging to where I feel the most restriction, and I can use a more diffuse contact of the palm of my hand, the hypothenar eminence, and I'm just kind of going into extension. And once we've kind of done that, something that we like to do here, so I just get a nice little pillow up under the wrist, and I'm going to take him into flexion and ulnar deviation. Scoot to your left for me. And I'm going to take him into flexion and ulnar deviation. Flexion and ulnar deviation, while I massage on the proximal aspect of the extensor muscles as they start to come into the elbow there. And that's when we actually found most sore. So he actually got some soreness trying to throw a fork ball. And so massaging those tissues is very, very important, because he got that little strain. I'm gonna do that. Okay, now we're gonna actually have him go up, move it around a little bit. So now I've got my massage gun. We've done actually a review on this particular massage gun, and I like it. You have to check that out. Kind of applying a valgus load here as I work into those soft tissues. So valgus load, it's actually putting more pressure into the soft tissue as I go into more valgus load. It's very light. He can actually rotate all the way out to here, but I'm just applying a little bit. I'm trying to get him loose, ready to go. From here, I got more of a foam, more diffuse contact. And basically, we're just trying to promote movement of the fluids in the area. And so what I'll do is I'll kind of come up and down the proximal portions, staying off of the bone there. It doesn't feel as good on the bone. And I'm just coming into the proximal portions, that brachioradialis, extensor digitorum, extensor carpi, radialis longus and brevis. Just coming in there and just kind of working through some of those soft tissues. Supination. We can do it in pronation and extension here. How's that feel? That's fine. And you know, this actual attachment here creates a little bit more friction when you get some of the metal and plastic attachments. There's a little less friction, just depends on what you want to do. You can kind of feel it more when we get into here. Good. And so I'm just doing it a little bit in the warm-up protocol. Now from here, what we're going to do is we're actually going to stretch him into pronation and stretch that supinator because he's a little limited. So what I like to do is come in with my knee. I prop him up on my thigh there. I rotate him, and then as I'm holding pronation, start to bring him into extension. Let me know when you feel a stretch. Right there. So he's almost at terminal extension, but a little bit shy. We're just feeling the stretch. Now, because this is warm up, I want him to activate into the range. So he's activating the tissues. Okay, turn your palm to the sky. Relax. And sometimes they'll try to rip your hand off them. They'll rotate really hard. Lightly, 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 lightly. Relax. Good. And we'll just hold it, bring him into a little extension, and then we're done. So now we're going to get into the throwing. We'll be able to get these masks off. We'll space out a little bit, and we'll get them doing some throwing stuff. We'll see you guys in that portion of the video. All right, so now we're into the throwing portion. Parker's up here. We're actually working on his throw a little bit, and what you'll see is he kind of wants to drag his arm out and around. So can you show us just step and throw here, Parker? And you see he starts to bring it in and then he kind of drags it out and around. And what he's having is some lateral epicondylitis symptoms on that lateral part of his forearm. So what we're doing is we're seeing that he's loading that part of the forearm really hard in the deceleration phase. And part of the reason for that is when his arm starts to go away from his head. So not only is he loading that brachioradialis muscle, that big muscle that you can see on the inside of my forearm there, he's loading it here extra because his arm's too far away, but he's also loading those extensor muscles really hard at the end because he snaps this way. So we got to get his arm in a better position during the acceleration phase. So one more time how you were throwing before. Still letting it go away a little early. So here's our kind of progression for the day. He's going to start and he's going to pull the ball in from the top. He's not thinking about anything per se, but he's thinking about bringing the ball in towards the center of rotation. So he's pulling in. Makes it harder for him to deviate into the wrong position. So now he's going to do that again. So we'll do a couple here just to show you guys a little bit of what we got going on today. And then we'll finish up with what we're kind of doing to finish up in terms of massage, get him feeling good, increasing that blood flow more. So now you see that he's actually bringing the ball in and staying in. So now he's going to jump and you see that, whoops, sorry Parker. You see that ball on the mound there? That ball on the mound he's going to actually use and he's going to put it inside his elbow, which is going to allow him to keep his arm in the right spot for longer without actively thinking about it. So there, he let it go away a little bit early. Grab that ball, Parker, and we'll jump and we'll do one more here. So he let it go away from his center of rotation a little bit too early still. So what we're going to try to focus on with him here is getting him to hold on to that ball a little longer. So he's thinking about the external result of making that graphite colored ball there shoot into the net straight forward. And you see he kind of threw it into the ground a little bit. The ball didn't go into the ground, but the black ball did. So he's going to continue to work on that. We're going to give it one more repetition here. And then he's going to do the same exact throw without the ball. So here he goes again. Better. Much, much better there. And so if you like this style video, make sure to let us know in the comment section. This is more of our vlog style patient case video. And we're going to try to show you a little bit of what we do here at the OAI. So we're showing you a little massage, a little stretching in this video. We showed you some stretching and some throwing in the other video. Now he's going to drop that black ball. You can throw that over here. Good. And he's actually going to go into... grab his glove, and he's done this. Now he's throwing from here. Now he's going to do that again without that ball. So he's going to try to maintain similar throw without that external device. There he goes. Hey, Parker, try to hit a little bit higher. So give him a little bit higher point of aim here. And so he's getting in this position. He's got the ball in close to his center of rotation. He's opposite where he was. Go ahead and go. Better. So now his throw looks much, much better. He's not placing the same loads on his elbow. We got to get him ready to throw this weekend. We've been working on that elbow a little bit over the past week. Now he's going to actually go from a low position with the ball. So now the ball is down here. He's got to bring that ball in towards his center of rotation in the way that he knows how to do it. We've been working on cueing of this optimal position as he moves forward, that IR apex position. So now his body is greased the groove. He's had neurological recall of where his arm's supposed to be. So now all he has to do is start from the right position and throw it, and he's going to follow a more efficient pathway. So go ahead. Better. And you see there's still a little bit of extension early, but it's not nearly what it was because we've taught his body a more efficient pathway. Now, if he would only do this 5 repetitions, 6 repetitions like he's done in this video, that's not going to make a substantial change or a long-term change in his throw. We're going to need to repeat this, and repeat this until his body discovers that this is the most efficient pathway, and it's the pathway of least resistance, where neurologically and physically, it's the easiest pathway for his body to follow. And then when that occurs, that's when he'll continue to use that pathway in his games and in his practices without any conscious thought as to how he's doing it. So one more time here, one more good rep. So after this throw, we'll kind of cut and we'll show you some of the massage and stuff we were going to finish with. Even better, even better. So Parker's a 15-year-old athlete here. He's actually, how tall are you, 6'2"?
Just 6 foot.
Okay, 6 foot. I gave him a couple inches there, but 6 foot, 15 years old. He's going into his sophomore season. He throws particularly hard for his age. So whenever you have athletes like this, making sure that you're addressing things the right way in terms of throwing mechanics so that they're following a more efficient pathway as opposed to a less efficient pathway. And then we're restoring motion, restoring blood flow to tissues that may be dehydrated, high tone, a little sore, things like that. And that's what we're going to show you here on the table. Shown to be effective in improving circulation to distal components, especially when you're dealing with some lateral extensor muscle bundle here towards the proximal portion of the muscle, towards that origin. You don't get necessarily as much blood flow in that area. So what we're doing is we're just using a BFR cuff, trying to create some more pooling of blood, potentially some more blood in those healing tissues. I got some goop on there. I got some Graston tool. And now that he's actually done throwing, we can go into a little bit more aggressive. Right now I'm just kind of spreading out. I'm just kind of spreading the lubricant on there, the deep prep. Now I'm going to have you scoot towards the edge of that table if you would. And you know, I don't need the BFR cuff to be really tight, but I just have it on there at about 50% to 60% occlusion. You can go up to a bit more because it's passive than you would with an active therapy. could probably go up to 70 or 80. I don't know that that's necessary. And this is sometimes uncomfortable. I'm using the diffuse edge to start with. I always do, and I'm kind of creating little half moons with that more diffuse contact of the Graston tool. And I'm going proximal to distal. And when I actually use the more focal end, I'll come in the opposite direction. You notice already he's getting some redness of the skin. Might get some petechiae. And then I'm pushing and I'm dragging on the way back. Push, drag on the way back. And another thing I like to do is I like to just do slow, short strokes with the tool. Push and drag back. A little too far on that one. So if you can see what I'm doing, I'm kind of pushing this way, dragging back this way. And there's a lot of different things you can do. But like I said, I'm trying to get things moving in there. Then I can follow up with just some dummy thumb slides across the skin. When you have some lubricant in there, this is a really effective and easy technique. Just using the side of my thumb, pressing in with the thenar portion of my hand. So kind of on this technique, and I'm just kind of coming along. This is, you know, similar to what you're doing with the tool. You're just doing it with a more diffuse contact, and you can really feel if there's any sort of denser, more knotted up areas, and it actually feels pretty good to me. But you can feel that with the tool as well. And then what I like to do, so we've done a little bit, you don't need to spend long. You can see the skin's a little more red there. Obviously there's more blood in the area. Now that we're done throwing, I might come in with the more focal contact of the massage gun. And I've come to like the massage gun recently, just to kind of finish up or start a treatment, just because it feels really good. I think it relaxes the patient. Whether it actually does anything therapeutic besides, you know, mobilize the little tissue and move some fluids around, I don't know. But I know it definitely desensitizes the patient, and that's a huge component, because, you know, sometimes we have this pain spasm, pain cycle, where you're constantly having pain and, you know, a higher tone, and eventually there's long-term potentiation or even short-term potentiation of some of these nociceptive pain fibers, and that just leads to further pain. So we can kind of stimulate the gate theory, break that cycle, and we can simultaneously improve some blood flow in the area, move some fluids around, and then also work psychologically. You know, there's a profound psychological effect from making something feel good that hasn't felt good in a little while. And you're stimulating all of the nerve fibers, all the proprioceptors in the area. But I generally like to use the more diffuse contact in a pre-throwing activity. And I'm just going over, I'm kind of going in line with the muscle fibers, but less so in a systematic fashion. And I can just kind of finish like we started, with a little bit of gentle elbow extension, pronation, lengthening, functional massage, where I'm not sliding on top of the skin. I'm massaging it in a way that the muscles will act in the sport. You know, it's great to lengthen the muscle in numerous directions, three-dimensionally, but ultimately the muscle may only act in a primarily two-plane motion during the sport. You know, if the elbow is extending and pronating, I'm going to apply elbow extension and pronation predominantly with my functional massage, because yes, I may be able to lengthen or shorten some tissues with different things. I could probably lengthen it, pronate it, and flex the wrist. But how much of that happens, and that probably wouldn't be this way, this probably would be, how much of this happens during the throw? Some, but if that's not what's aggravating the pain, then it's not totally necessary. So I'll just finish with this. Guys, thank you for watching the video. Thanks to Parker. We're gonna get him unconnected or detached here from the BFR. Get him on his way. Throwing a lot better, feeling better. We're gonna keep working on improving the blood flow through this arm. Keep getting those collagen fibers to align and healing the right way. And guys, if you're new to the channel, make sure to subscribe. When you subscribe, you're gonna see more of our videos. We're gonna try to do more of these patient cases. If you guys like these patient cases, let me know, because I can do a lot more. I have access to a lot of athletes we can put in these videos. I can show youth guys, I can show high-level high school guys like Parker here, I can show some college guys and some high-level elite throwers. Whatever you guys want to see, whatever it is that, you know, would interest you guys, we can do some longer videos where we're sitting here for a patient case going through an entire treatment. We can kind of break it up, show you just portions of the treatment. That's up to you guys, but let me know in the comments section. Don't be afraid to let me know on social media either. OAI Training on Twitter, great place to reach us. But like I said, subscribe to the channel, like this video, and we'll see you in the next one.